Good evening, ladies and gentlemen. My name is Tabang Matuna, a South African second-year student at the African Leadership Academy. I'm so glad that you have been able to join us this evening. We are going to be discussing building a billion rand organization in a week. And I know that sounds very far-fetched, but I am with someone today who is part of a team that is doing that. She is the executive director of Yellowwoods. She is the founder of Harambee Youth Employment Accelerator Program. She's currently working in the management team for the South African Solidarity Fund. Ms. Nicola, thank you so much for joining us this evening. How are you?
I'm very well and so delighted to be here. Thanks very much for having me.
I'm so glad that you've made the time to be with us. For everyone that is going to be part of this conversation this evening, please feel free to put your questions down on the question section. Also, the people who are joining us via the Facebook live stream, put your questions in the comment section on the Facebook section, and we'll make sure that your questions get answered. Now, to kick us off, Ms. Nicolai, once again, thank you very much for being part of this conversation with us. For the benefit of our international audience, could you please just tell us what the South African Solidarity Fund is, what the hope of the organization is, and what your role has been in the organization for the time that you've been working with it?
Thanks, Tabang. So the Solidarity Fund in South Africa was established, it's now 5 weeks old. And it was originated by a combination of the president of the country as well as business in the country, agreeing that if South Africa was going to respond with the kind of agility and urgency that we needed to the COVID pandemic, that we needed an organization that could combine the efforts of government, the private sector, and civil society in a single organization, and also that could mobilize funds and deploy funding really quickly, and not have to work through the complex and quite slow processes of government, but also not have to deal with the problems of different businesses that may be competing with each other in the market. So that's how the Solidarity Fund came about. I think it was a brilliant idea for which I can take no credit. But what did happen is that one of my colleagues, Adrian Enthoven, was asked by the president to be the deputy chair of the Solidarity Fund. And when his name is Adi Enthoven, and when Adi sort of said, okay, I've been called up, it's like a military service, I got drafted simultaneously. It was like, okay, come and help. We've got to set up an organization. So pretty much day one, really, I found myself needing to, part of a small team of people that had to set up the organization. It's now a much bigger team, all of us on a pro bono basis, that have established and are running the Solidarity Fund in South Africa.
Oh, wow. I think I should say on behalf of the South African people, thank you very much. We understand that the Solidarity Fund functions in collaboration with the government and the people who are donating to the organization. However, it is an independent organization. I just want to know why the emphasis on the organization being independent, and how do you ensure that the organization stays independent from the people who contribute to it?
Thanks, Tabang. So I think, to say why it's important for it to be independent, I think, again, there are obviously very different interest groups in society who at different times will, be at odds with each other, and not necessarily aligned. Sometimes people are partnering with government, sometimes people are critical of government, and that's all very positive in how democracy works. Mm-hmm. This is a pandemic that requires a united national effort, but in a way we need a trusted, neutral organization, something that can stand in between those different stakeholders in society and be a trusted platform that everybody can believe in, can contribute to, and can help to unify our effort in response to the pandemic, even while we might be disagreeing and fighting over other issues. So I think that was a key issue for independence. I think the other reason, I mean, just, you know, I think it's allowed us to gather money from different sources. There are quite a lot of philanthropic organizations who wouldn't be able to give money to government. For example, for the procurement of, health supplies, they would want to help South Africa to acquire those things, but they wouldn't be able to give that money directly to government. And so they need an independent vehicle that they can, an independent entity that they can put their money into. And then I think similarly, government actually needed an independent vehicle because they needed something that, for example, isn't subject to the complex financial requirements of the PFMA, which is the government rules about how they're allowed to spend money. And this way we can, as a country, spend money sort of slightly outside of those normal rules. So I think there are lots of reasons for this entity to be independent. But I think the most important one is trust, you know, to just create a space where everybody can trust this thing to work just with a single focus of helping South Africa to address this pandemic.
Thank you very much for that response. I also want to know, how will the Solidarity Fund select the causes that it supports?
So the Solidarity Fund has a kind of mandate, let me put it that way. So that creates the sort of a framework in which we have to operate. And our mandate is to do 4 things. It is really to help. Firstly, it is to be a rapid response entity. So we're expected to raise money and spend it as quickly as we can, right? We're not expected to make long-term plans or, you know, think about how to spend the money over a long period of time. We actually expected to try and respond as quickly as possible, because the pandemic is so time sensitive, and the more, you know, every week that we lose, you know, is a cost to us as a country in fighting the pandemic. So being fast is a really important part of our mandate. We have to, we've got sort of 4 things that we need to try and contribute to. The first is the prevention of the spread of the transmission of the virus. And contributing to the country flattening the curve. I'm sure you've had some, I know you've had some webinars about the pandemic itself, and to think about how the transmission curve happens. But so one of our jobs is to try and help and contribute to flattening the curve and to prevent the spread of the virus. The second is to focus on detection, so testing, and to enable the country to know what's going on so that the country can plan better. And so that's testing and contact tracing and things like that. The third is care, to make sure that our health system is ready and able to deal with the increase in people that require ICU or require just hospital-based care, or that there are additional health facilities available to treat people. So that's what we call care. And then the last area is support, which is, it's really it's a more kind of a humanitarian or socioeconomically focused intervention, to understand that the impact of the pandemic will be felt worst by vulnerable and poor families in South Africa. And to make sure that we're able to support those most vulnerable families in South Africa to mitigate and to cope with the worst impacts of the pandemic. So those are our sort of mandate areas. And then within that, we work on an ongoing basis to understand at any given moment what is really needed for us to respond to. And in choosing those, what you're calling the causes we want to support, within that mandate. Our first principle is that our job is not to replace government. Our job is not to replace the market. Our job is to step in to the space that neither of them are able to occupy at this point, right? So, and civil society as well. I mean, civil society organizations are playing a very important role at a community level in addressing the crisis. What we need to do is amplify those efforts, amplify what government is doing, amplify and support what civil society is doing and the private sector is doing, and really do step into the space that they aren't able to fill. So I can give you some examples if that's useful.
Yes, please do.
Recently, so I mean, I say recently, we've only been 5 weeks, it feels like 5 years, but so the two examples. So the first is that, as you'll know, one of the most important things for the country to do is to acquire the personal protective equipment that the health workers need to protect themselves from the virus, right? So that our health system is able to keep caring for everybody who's sick, right? And our health workers, if your health workers get sick, your front line has been destroyed. So it's been really important for us to make sure that the country has the protective personal equipment, that's masks, gowns, gloves, and a whole range of other personal equipment that's needed to keep people safe when they're dealing with people who are sick. Obviously, the first line of that is the health workers, but then, of course, there's community care workers, there's people who work in care homes, there's people in workplaces who may be dealing with testing, and there's people out in the community doing testing. They all need PPE. Now, to compete in buying PPE globally is a really difficult thing. At the moment, there's scarcity of these things globally, right? You just can't buy masks, you can't buy ventilators, you can't buy these gloves and gowns, right? There's scarcity and the prices are crazy, right? Because all the countries in the world are competing for these things. And we can try and start manufacturing some of them locally, but government procuring them is difficult because the prices are outside of the prices that government had kind of set originally to pay for these things. Yep. And the government systems are quite slow. Secondly, you're competing in this global market where you have to like respond every day and try and find the stuff for South Africa, and make sure that South Africa and other African countries can access these goods while they're so scarce. And so we were able to, within 1 week of establishment, start a very effective process of procuring those things globally for South Africa on behalf of the government system, even on behalf of the private sector hospitals, and on behalf of community health workers, and to be able to get them into the country. And so when you say we've raised R1 billion, we've actually raised 2.7 billion Rand, but the more extraordinary thing is we've already committed 1.3 of that billion Rand already in expenditure. And a lot of that is towards this buying of personal protection equipment and testing kits and testing equipment so that South Africa can ramp up our testing. So those are things that are now coming into the country, and hopefully we're going to have enough of them. We're at that stage of the pandemic where it's going to start ramping up now, especially as we open up the economy again. And the demand for these things is going to really increase by June. And we've been able to act quickly enough to make sure that by the time that happens, the country has what we need, right? So that's the one example. The other one this first month was that very early on, in the first week of operation, we recognized that one of the most sort of extreme impacts of the lockdown on vulnerable families was going to be the impact of food insecurity. And so right from week one, we set about saying, how does the Solidarity Fund intervene in this month of the lockdown, in this period of stage 5 and going into stage 4, to help those most vulnerable families tide through the lockdown without effectively, they live normally at the edge of food insecurity, and we knew that the lockdown would just tilt them into really significant crisis from a food point of view. So we set about focusing on that in our first month, and we did two things. I mean, the one is that we started to work with the government and the private sector to say you need a more sustainable solution for this issue. There's no amount of food parcels that can solve this issue if this is going to be a 6 to 9 month process. So we started already then advocating for additions to the child grant. We were working with the government partners and the private sector to help the government think through and come up with the kinds of solutions that the president then announced at the end of April around the increase in the grants and the basic income grant that will be flowing to some of these households that are in distress. But we knew that there'd be like a 2-month lag, effectively, that there'd be this gap, right? That while you're waiting for the grants to come through and you're waiting for the market to reorganize itself, that there'd be this gap, and that there were many, many households that just wouldn't survive this gap. That 2 months was too long to be in this kind of crisis, and that we were potentially facing a humanitarian crisis in South Africa, which we've never faced before, because actually we are a food secure country. So we stepped in that month and have implemented probably one of the biggest food distribution programs, certainly in South Africa, which was that we've delivered food parcels to, I think it will be by the end, 300,000 households within 3 weeks. That's about 1.5 million people who were facing absolute crisis from a food perspective, who will have received food for the entire month. So they've got food to tide them over for a month for 300,000 households, and that is across the whole length and breadth of the country. And we were able to do that because not just about deploying funding, but being able to mobilize business to do logistics, mobilize community-based organizations to do the last mile distribution, faith-based organizations to identify the vulnerable families, as well as NGOs with experience in food distribution to be able to, to distribute to different parts of the country. And so we were able to mobilize a sort of wide range of organizations and stakeholders to be able to sort of implement that distribution in such a short space of time. Those are two examples. So, in terms of what we will choose next, I think that the country is going into a different phase, and so our response needs to be different, right? So
indeed.
And we will identify the new priorities for May and June based on the next phase that we're going into.
Okay, that's some pretty amazing work that you're doing. I came into this conversation knowing that the Solidarity Fund is doing some pretty amazing work, but now that you get into the details, I feel proud to be talking to you at this current moment. To remind our viewers at home, please be sure to ask the questions that you have, and we'll get to those questions in the second half of this conversation. To you again, Ms. Nicola, do you think that organizations such as the Solidarity Fund are going to shape how money is raised in the future for other causes that human beings feel passionate about?
That's a great question, Tabang, and I don't know if I know the answer. I think that there are a few things that I would hope would be some of the legacies of the Solidarity Fund. One of them is, it really is a demonstration of common purpose, and I think, of this ability to just decide we're going to do something together. We're going to kind of put our differences aside, put our usual fights and and differences aside, and we're going to agree on a common purpose goal, and we're going to do something together across government, the private sector, and civil society. There are not many instances of that, and I think we've been really struggling with that in the world recently. A lot of these kinds of, even multilateral institutions have been under threat, and I don't think that that's gone away, but I would hope that the Solidarity Fund can be some kind of demonstration of what can be achieved when we do pull together in that way. So, whether this will be a new way of funding things, I think that the most interesting question will be not about what donors do, because I think donors have been moving in this kind of direction for a while now. Mm-hmm. The real legacy will be if we've been able to demonstrate how government and the private sector can do things together in a really powerful way, and combine their resources, and their resources are not just money,
Yes.
When you face the challenge of getting food across the country, Coca-Cola and the beer companies that aren't allowed to sell beer at the moment are real assets, right? More than money is people who know how to get things from one side of the country to another, and who have the capacity to do that. And can you sort of pull those kinds of assets together in a crisis like this? And I think we're testing that by doing stuff right now, but it's early days. Let's hope it can all hold together. I mean, I think, I'm incredibly proud of what we've achieved, and but it's a really hard road, and I think that we're already seeing, as we come out of stage 5 into stage 4 in South Africa, some of the social fabric is already fraying. People are feeling a lot of stress, and people are under a lot of stress, and it's quite hard to hold things together under those conditions. So I also don't want to kind of paint an unrealistic picture of the role that we can play. We're a small part of a very big puzzle here, and it's a very complex world to navigate.
Okay, thank you. We have quite a number of questions from the audience at home. If you don't have a question and you are watching this, just read up the questions that we have and give the ones that you like an upvote so that we see them first. The question at the top today is from Ms. Maya, who is asking, how do you mitigate and reduce any potential for corruption or mismanagement in the implementation and distribution of the funds?
Great question, thanks. So I think one of the, firstly, the fact that we're an independent organization, and I think one of the things that we're both proud of but feel an enormous sense of responsibility about is that if you look at where our money comes from as a fund, yes, we have received some really, really big donations from, a few very, very big high net worth families or some big corporations, but actually the money that we most value and that we feel most accountable for is that over 75,000 individual South Africans have given money to this fund. And some of those are, people who are paying 1 or 2 rand when they're shopping at ShopRite Checkers, right? And wow. Some of those are, people who are just giving money and then, like as a charitable donation. And then a lot of people have been doing salary sacrifices. So, people have been giving, I think the president set that example by giving 1/3 of his salary, and a lot of people have followed him. And so we are spending money that belongs to ordinary South Africans. We are not, this is money that we feel very accountable for. We feel a big burden of responsibility to spend the money well and to make sure that there's no corruption, leakage, or kind of, misappropriation of this money. So we really are placing a lot of focus on the governance and monitoring and financial management processes. We're being very careful in our contracting and tracing of the things that we're funding. and trying to be as transparent as possible with the public about what we're spending the money on. I think the other thing to say, and, you know, I mean, obviously, you know, people are worried because sometimes we are working with government, and some people might believe that there's a real challenge of government being corrupt. I mean, what I can say is we're never spending money. You know, we're not just handing money over to government. I mean, we're never handing money over to anyone, actually. We're saying whoever we're spending money with, we want to have line of sight of how that money is being spent. And we need to be able to account to our funders on that.
Okay. Thank you very much for that. Someone wants to know, what are the lessons that you have learned since you started working with the Solidarity Fund to date?
Wow, lots of lessons.
Just give us the top. Just give us the top 2 lessons that you've learned.
The most, well, you can never please everyone all of the time.
Yes.
That's a really important lesson. And especially if you're trying to do something bold, and you know, if you're holding yourself up to high standards, and others are holding you up to very high standards, one has to be quite, you know, you have to be real about the fact that, you know, you can't please everyone all of the time. And it's very challenging to manage people's expectations because the need will always massively exceed what we're able to do. So I think that's been lesson 1, and just managing the challenge of expectations that way exceed what you're able to do, and how to be resilient through that process. The second lesson has been that there is so much power and value sitting in the hands and the hearts of ordinary South Africans at every single level. And that if we're able to mobilize that, and if we're able to work with South Africans at all levels, community-based organizations, faith-based organizations, companies and corporations, individual, different political parties, just everyone. When you combine that, there's so much power, and there's so many amazing, talented, committed people out there, and there's so much goodwill. And I think already in this month, we've been incredibly humbled by just, you know, how much we've been able to mobilize, and how many people have put their hand up, come to the party. You know, people with very few means themselves, just willing to put in so much effort and go so many extra miles, and often take quite big risks themselves, actually, to make this stuff happen. If I think about some of the community-based organizations we've worked with who have been delivering the food, you know, in the rural areas of South Africa, and in some of the informal settlements, some of them got arrested doing it. Some of them, faced the risks of needing to manage the safety issues. They're dealing with very volatile and distraught people who are really struggling with hunger, and those are very tough environments that they're working in, and they've just amazed me and humbled me as they've demonstrated that their hand is up to do it, and they've done it. So I'm really grateful for that. Wow.
Thank you so much for that response. I think quite central to the second lesson that you learned is the power of people. You said in your own words, ordinary South Africans just contributing. And I think that's something that's really important, that does not only resonate with us South Africans, but everyone else in every single country that's currently dealing with this global pandemic. Which leads me to the next question we have from an audience member, Ms. Gloria, who says, do you meet as the Solidarity Fund and discuss ways that other such holders of office from other countries? Okay, let me repeat the question again. It says, do you, as the Director of Operations of the COVID-19 Solidarity Fund, meet and discuss ways forward with other holders of office from other countries?
So it's again a great question, and in our 5 weeks we haven't done that yet, but it's already been raised as a question to us by several different organizations, and including our presidency, who, as you know, our president is the chairman of the AU at the moment.
Yes.
And so this question has been asked as to whether there is a way in which some of the things that the Solidarity Fund is doing, let's take, for example, the procurement of the health supplies, whether there would be sense in us being able to partner with other African countries or be part of the solution with other African countries around us bulk procuring together, or creating some of the Africa-focused manufacturing solutions. That means that we can start, and I mean, it will be a two-way thing. If South Africa can start manufacturing some of these goods and make those available on the continent. Similarly, I'm sure in many other African countries, there may be opportunities to manufacture other of the goods which could be available in South Africa. So I think there is going to be an increasing focus on how we work in a more collaborative way across the continent in particular. But it's early days right now. We have just been focusing on this month on trying to cope with some of the crisis here.
Mm-hmm. Another question that we have is, is this pandemic an opportunity to allow fellow South Africans to produce test kits and personal protective equipment to boost certain sectors of the South African economy?
So great question. So I think there definitely is opportunity. One of the difficulties has been timing. So some of the, we don't have the luxury of time, right? So we had to procure globally until such time as our manufacturing capacity can get up to speed and up to meet the quality requirements and the specs required. So I think there's a sort of time lag in some of the areas. But for example, as a Solidarity Fund, we've already funded some prototypes, some prototype manufacturing of ventilators. That's an interesting example because ventilators is one of the areas where actually we have been unable to procure what we need globally. Because the prices are so crazy that we would kind of bankrupt the fund and the country pretty quickly if we were to pay those funds and those prices. And so there's been a big focus in South Africa on trying to scale up ventilator manufacturing, not of the most high-end ventilators, because I don't think we actually have the engineers, the engineering capacity quickly enough to meet the quality standards and the complexity of some of the high-end ventilators. It would take time to demonstrate that we have that capacity. Whereas actually we can be quite innovative and say there's actually other kinds of ventilators that aren't needed in ICUs, but that can be used in general wards, in communities, in field hospitals and isolation facilities. And those kinds of ventilators we definitely can manufacture.
Yes.
And so to be quick and sort of responsive, and now we're not necessarily doing all of that as the Solidarity Fund. I mean, a lot of that effort is happening through Business for South Africa, which is a business coalition that's been established to organize business around the pandemic. And then, of course, by the Department of Trade and Industry and other parts of government that are trying to spur that local manufacture. I mean, the other thing I know is happening is that, like, the clothing industry, which of course has had a lull in, they've had spare capacity and things because of the sort of shutdown of the clothing industry. They have got a whole bunch of factories producing masks, fabric masks. So, you know, kind of like get going on that. So very, very different kinds of issues around manufacturing. So I think there's a big focus on it, but I think it'll be uneven. Sometimes we will be able to manufacture. Sometimes we will have to keep buying globally.
Yeah. Ms. Nolizwe Mhlaba wants to know, what does this fund mean for many undocumented immigrants who contribute to the South African economy?
Again, another really great and important question.
Yeah.
So one of I spoke earlier about the food response that we have implemented this month. And we were very clear that one of the approaches that we took in the way we designed the intervention was to make sure that we didn't just work with the Department of Social Development, because that would have effectively, if their lists would only apply to South Africans at the moment, and would have excluded undocumented migrants, and actually undocumented South Africans, of which there are also quite a lot, let us just also say. So what we did was be quite deliberate as well about working with NGOs and CBOs that we know, operate in communities where they are not going to make that discrimination, right? They are going to identify vulnerable households, irrespective of whether they're South Africans with documents or without documents, or not South Africans, or visiting South Africans, or people living in South Africa, and that we weren't going to make a distinction. For us, what was important is that people living in South Africa need to, are part of South Africa, and we need to treat everybody as vulnerable to the pandemic and also vulnerable to the impacts of the economic disruption. And so we have tried to be completely open in our response on that. I think going forward, it's an ongoing question, because as the new grants come on stream, I think even the government is aware that the new grants that they've introduced still won't really address the challenge for migrants in South Africa, or people, people who are immigrants here. And I think that the informal sector is the most disrupted, right? And a lot of people who have come to South Africa seeking livelihoods from other countries are operating in the informal sector, and that is, life is incredibly tough in the informal sector. So I don't want to claim that we've got the answers to that question, but certainly as a Solidarity Fund, we know that we have an obligation to be thinking of everybody who's in South Africa, and how we're going to all get through this.
I think that answers the question. We have another question from Mr. Mike, who's from Nigeria, who I think resonates with many of our audience tonight. He's asking, the Nigerian government, both state and national, received so much funds, but we could not pinpoint what the fund is used for. How can we hold people in authority accountable for how can we also be part of management of the fund? So Mr. Mike wants to know, how can ordinary people who are contributing to the fund ensure, and how does the Solidarity Fund, for example, ensure that the people who are giving to the fund participate in making sure that people who are in charge of distribution are accountable?
So I think there's two different scenarios here. I mean, in the case of our fund, I mean, we're kind of highly committed to transparency. We've publicly committed to the fact that we will be transparent. So in that sense, we have taken on the obligation, and if people are demanding that transparency from us, and we accept that we have to respond to it and share transparency. I think that so we will do that, but that's very different from, I think, the broader question that is being asked about, in the case of state governments, for example. I mean, I would say it's not that different under COVID to how it is at any other time, which is, how do citizens hold governments accountable in a context where, where accountability processes are complex and sometimes quite weak, right?
Mm-hmm.
So, I mean, I think though that, you know, there's a real opportunity in this moment to think about quite a lot of citizen activism and citizen involvement in monitoring what's going on and in making what's going on visible. You know, I mean, I can just give little examples in South Africa, you know, I mean,
Mm-hmm.
you know, if we all understand that, I mean, I'm not going to use a government example, I'm also going to use a civil society example, right? If the taxi industry has agreed that the rules of operation are that they'll only have half full taxis, right? So that people
Mm-hmm.
can social distance in taxis. And if the rules are that people should wear masks, and the rules are that people should, you know, that there should be hand sanitation facilities, you know, do
Yes.
those things exist? Do those things exist? Well, you know, ordinary commuters could be playing a role of monitoring and sharing information about whether those things are happening or they're not happening, right?
Mm-hmm. Mm-hmm.
And I would say similarly, you know, in public health facilities, you know, if the government says they've bought a whole lot of, you know, PPE for the hospitals, you know, do the hospitals have them? And are people going to the hospitals and checking out and talking to people? So there's a kind of, I don't know, it's like a citizen journalism thing. It's a citizen monitoring thing that I think this crisis may be, I mean, at any given time, that's a viable route for people. But I think this crisis really lends itself to a kind of very mobilized citizenry around those kinds of things, you know, because we each other's keeper in this situation. We really are.
So this crisis is just bringing in this whole idea of how much of an opportunity it is for us as society to look at ourselves and discover the things that we have wrong or right in society as it exists. A question that we have from Ms. Grace is, post the COVID-19 pandemic, will the Solidarity Fund continue raising funds to support future calamities or intervene in other situations such as these ones?
Thanks. So that question hasn't been answered yet.
Mm-hmm.
I think at the moment, the Solidarity Fund sees its immediate mandate to respond to the COVID pandemic and to, you know, and the impacts of the pandemic and the economic disruption on our citizens.
Yes.
There's already questions about, you know, when is the end of that? You know, is the economic recovery part of our mandate? That could extend the life of the fund quite a lot. I don't think we've answered these questions yet, and I'm not sure we will for a few months. I think we need to see how things play out. As I said, you know, we almost obliged to spend the money as fast as we raise it. So it doesn't lend itself to taking a very long view. And the fundraising environment will also shift. So, you know, you can raise money in a crisis that you may not be able to raise, you know, when things are in a new normal. So we'll have to see.
Okay. Thank you for that response.
I don't have COVID though, I don't think.
Okay, good. Another question that we have is, are provisions and distributions made based on the density of cities and towns, or are they based on people's level of poverty?
So different in different areas. So on the food question, we specifically organized our food response on the basis of poverty wards. So we mapped the poverty wards in South Africa, but on a proportional basis relative to population. So in that sense, there are a disproportionate number of poor people in, for example, some of the informal settlement parts of the metros. And then there are a large number of poor people in very rural parts of South Africa. And we were able, and again, different proportions in different provinces, but we did it on a population and poverty map. And we designed our intervention accordingly to that. On the medical supplies, though, we're not applying that principle. And on the medical supplies, we are largely being driven by the National Command Center and an understanding of the public health services and where the needs are greatest in the public health system. And then also understanding, you know, the prevalence of the pandemic. So it's about following the epicenters and prevalence of the pandemic. And this pandemic knows no race, no class, no gender, no nothing, right?
Mm-hmm.
It's following its own course. You know, and we're struggling to understand the course that it's following in South Africa. It's jumping around in ways that are difficult to understand. So, but wherever the pandemic goes, we'll have to respond.
Okay. We have a question from Gateko, which is coming from our Facebook live feed. He's asking, how do community-based organizations on the ground he's asking, how do community-based organizations get involved in the food distribution? Is there room for new organizations to join the Solidarity Fund in the work that it does?
Thanks for that. So, you know, the answer is yes and no. And what I mean by that is that the Solidarity Fund is not, it's not funding organizations. Mm-hmm. So we're not a foundation funding organizations. We are funding interventions, and then we are seeking the best kinds and the most appropriate organizations to work with to execute those interventions. So in the case of the food response, that included large-scale logistics companies as well as very, very small local CBOs in particular geographies that needed to be reached, right? Mm-hmm. It wasn't like, you know, where there were charities and NGOs and CBOs already operating in the big metros, they actually weren't a focus for us because, in a sense, they were covered. Those households were covered. And the households we were seeking to reach were in areas where they weren't reaching. And we had to actually try and find organizations in those areas, those kinds of wards that I've been describing, you know. We were recently just looking at the Khalahadi, you know, in the Northern Cape. I mean, families that are literally starving, and there aren't NGOs that would normally reach those areas, right? So I think we've been quite sort of deliberate in our interventions rather than kind of funding organizations. I just want to be clear on that. Having said that, I think that especially in this next phase, what we're very keen to do, and I think I really stated, is that where there are existing organizations that already are mobilized and doing great work is how do we link them up, coordinate efforts better, or maybe amplify what they're able to do by linking them up to others with resources. It may not be us, right? But so, for example, I'll give you examples. You know, in the early days of the Solidarity Fund, we had many, many offers from business to say, you know, I've got a fleet of cars, you know, that is standing idle. Do any community-based organizations need these cars to do something, right? Or, you know, I already distribute, you know, food to wherever. Should I also include spazas on my distribution route, right? Now those are things that I think we as the Solidarity Fund can try and play a role in supporting, but I wouldn't want to create the expectation that we're going to be a fund to fund a lot of NGOs and community-based organizations, because I think that's just not realistic for us to do.
Okay. Another question that we have from Jingwi Carlson is, how fast can the Solidarity Fund extend to other African countries? Is there a plan for the South African Solidarity Fund to work with other countries to establish organizations that are similar to this one in those countries?
So there isn't a plan at the moment to do that. I think that we could, as I say, we could certainly provide advice and support to other countries that want to replicate the model. I think there'd be a lot of people working for the Solidarity Fund at the moment who'd be very happy to play that role and who'd be very committed to seeing a similar kinds of things happen in other countries across the continent. And as I think what we can do is try and, there are quite a lot of global donors and global development agencies who would like to be able to fund the South African Solidarity Fund, but also to fund similar initiatives in other African countries. And so I think there would be real donor appetite if those countries initiated something similar. And I also think that, as I said, I think there's an opportunity to be smart about joint procurement, where we have to buy things, we can get better prices if you buy more. And also there might be donors, as I say, there might be global donor agencies that would be keen to buy things that can support many African countries rather than just one or two.
Yes. So to our audience at home, we have a couple of more minutes left for this conversation. If you have a question in the Q&A session that you really like, make sure to vote it up so it gets asked in these couple of questions that we have left. One of the final few questions we have is, what do you believe the lessons have been for the public sector and for business in the new way of working together?
Oh, so it's really early days, but I think I think that, and it's hard to really declare any victories yet, or even really even say some lessons, because a month is a very short time. But I think that we've already seen it's been interesting because we've already seen the public sector say, wow, we're so relieved and so excited that there is this capacity to have the private sector help the public sector to do this procurement. Then there's been another moment of saying, oh my goodness, no, we don't like the private sector doing this. We don't think we do BE well, and we don't think we're doing supplier whatever well, and no, we're pulling it all back into government. Go away private sector. Oh no, come back private sector, we really need you. And so I think we just have to be real that I think we're all learning as we go along about how to work together and how to play to everyone's strengths, and to build trust. Trust is hard. Trust is easy to break and hard to build, and so it's a journey. And so I think the lessons are just it's a rocky road. Is the answer I would give you. I don't want to paint any rosy pictures. I think it's a rocky road, but it's a journey we're on, and I think that there's going to be lots of good lessons learned in that process.
Okay. Another question is, since wearing a mask has now become a requisite for level 4, should the government now supply correct masks to the elderly?
So I think that we do need to supply masks to the most vulnerable citizens, whether the elderly are one of those categories. But we also need to understand what masks do and don't do. The most important reason to wear masks is to protect other people, right, rather than yourself. And so it's not just the elderly who need to wear masks, right? I mean, everybody has to wear masks because everybody has to assume they're sick. And if everybody assumes they're sick and potentially a danger to another citizen, then we should all wear masks when we're out and about, because we're actually wearing a mask to protect other people from ourselves, right? And so I think that one of the projects we all need to sort of get into is everybody should be making masks and everybody should be wearing masks, and how sort of young people can become sort of champions of, that social distancing is the new is the new social responsibility, you know, and wearing masks is just what we do when we're trying to protect other people from ourselves. You know, I think those are the things we need to, these are new ways of living that we're going to have to start getting used to. But you don't need government to supply masks to ordinary citizens. I mean, these fabric masks are really enough. So for this, right, I'm not talking about when people are sick. When people are sick, it is a different, and people are showing symptoms.
Yes, yes, yes.
Right. When people are showing symptoms and have been tested and are known to be sick, or are known to have COVID-19, that's a different situation. But for all of us who just may be carrying the virus and not even realize it because we're asymptomatic, right? And you know, and are going back to workplaces or are going back to schools, or, you know, we just need to learn to live in a new way. We need to learn to wear masks and to keep our distance from people and still love them.
Thank you very much, Ms. Nicola. I wish we could continue this conversation for an additional hour, but we unfortunately cannot. This brings us to the end of the conversation we have today. I know there are a couple of questions that have yet been able to get answered, but I hope that people can, this conversation will be a catalyst to get people out there to start reading and learning about the different ways that they can get involved in fighting this pandemic. Thank you so much for being with us this evening. I know it has been some time and you've carved up a bit of your time in this busy period. So thank you so much. I'll hand over to the woman who's been in charge of bringing this together. Ms. Khalalelo, over to you.
Hi, Thabang. Hi. Thank you so much. Hi, everyone. My name is Khalalelo, and I'm from South Africa. And as Thabang rightly said, I'm the coordinator for the Executive Speaker Series here at ALA. Normally what these series is, or how these series would run, is that we would have speakers come physically on campus to engage with our ALA community, but in the spirit of social distancing and the times that we're living in, we thought to leverage on the amazing webinar technology that we have, and a chance for us to connect with you, our wider ALA community. Nicola, thank you so much for joining us tonight. You know, I know the Solidarity Fund is South Africa's response to the social need brought about by COVID-19, but I think I can confidently say that our audience from across the continent, across the world, would want to take a page out of the work that you and your team are doing. And I can imagine it's such a busy time. So thank you very much for making the time to speak to us tonight. Thabang, to you, thank you for joining us. Thank you for hosting it so beautifully. You took up the challenge in the middle of exam seasons and you've done great. Thank you for joining us and thank you for your time. And to our Zoom and Facebook audience, we've had an audience from, just to name a few, Cameroon, Uganda, Morocco, Nigeria, and across the world. So thank you for joining us tonight. The series is in its 5th week today. We will not be having a webinar next week, but we hope to resume soon. But in the meantime, let's keep connected via info@africanleadershipacademy.org. You can send your feedback on the series so far to that. Also, still inviting you to send us recommendations for speakers that you feel may be suitable for such a platform in the near future. But on behalf of ALA, please stay safe and goodbye.
Thank you.
Goodbye.